What is endocrinology and how it differs from physician?
Specialty is general medicine or general physician, and endocrinology is a level above general physician. So it is super specialty. So general physician completes 6 plus 3 years of education to become a doctor.
Okay.
Endocrinologist completes 6 plus 3 plus 3, so 12 years.
Okay.
And he specializes in treating hormones and hormone related problems like diabetes, thyroid, growth, obesity, PCOD, hypogonadism, and osteoporosis, problems related to calcium, phosphorus, weak bones, and many other things.
Okay.
But mostly what people know is endocrinologists treat thyroid and diabetes, but there is beyond that to endocrinology. Hypogonadism is
Hypogonadism. What is
decreased functioning of the gonads.
Gonads.
So the sex hormones.
Gonads means what is this?
Gonads are
Please
testes in males and ovaries in females.
Okay.
So if they don't function properly, females may have irregular cycles, irregular menses, and males may lose the interest in personal life.
Okay.
So that is gonads. So
okay. This is also vital things.
this is a very common problem, but people, they don't want to explain, and they don't want to consult a doctor many a times.
So once a person is suffering with diabetic, then what are the common health related issue he or she will face in a later stage of life?
So this is a very misconception that once somebody develops diabetes, he will develop kidney disease, he will develop nerve problems, he will need to amputate later in life. Yes, that happens in many people, but let me make this point very clear, that if the patient with diabetes has his sugar levels under control right from day one, as soon as he is diagnosed, he can live just a normal, healthy life just like any other person. He will not develop neuropathy, he will not develop retinopathy, he will not develop nephropathy, he will not develop any complication of any other organ. Indeed, I have patients who have been diabetic for 40, 50 years and still they don't have any complications of diabetes. So everything points out to this one thing, that keep your sugar levels in control right from day one.
Okay.
Then you are assured that you will not have any complication of diabetes. But however, in India, because of many false news and all, people think I was diagnosed very recently, let me wait for 2 or 3 years, what will happen? Because he doesn't have symptoms.
Mm-hmm.
So he will wait for 2 or 3 years, even though the sugars are high for 2 or 3 years.
Okay.
He just neglects, I'm a very young age, why should I take medicine? Young age medicine does harm to my body. So if I start from now, I have to take it lifelong.
Mm-hmm.
So this is one big thing, that patients somehow they are misguided by their elders, friends, or neighbors who are not at all medically qualified people to not to use medications. And once they develop symptoms of diabetes, half of the damage is already done.
Okay.
So if somebody develops neuropathy, it means 50% of nerves are gone.
What are the symptoms basically the people will get are the early symptoms what they'll get?
Yeah, so we have to understand this, that diabetic patients, they need not have any symptoms.
Mm-hmm.
So how do we catch them is to test them annually. Any person beyond the age of 20 or 25 years, it is advised to get sugar test done at least yearly once. So if they don't have symptoms, they will get picked up by these blood tests.
Okay.
Nowadays, diabetes is becoming common even in the 20s, early 20s also. Many people are getting affected with diabetes. Okay. On the other extreme side, we have patients who have all classical manifestations of diabetes, that they will pass more urine at night time. They have more thirst, they lose weight, they have weakness, they have cramps all night.
Mm-hmm.
And unfortunately, some people will also develop some urine infections, especially females after their menopause. Some people can develop blurring of vision. So pictures which were clear, they start to blur.
Yes.
So people think it is just a change in my eyesight. So any person who experiences change in their rapid change in their eyesight, power of lenses, they should always check for blood glucose levels. So vaguely, if you want me to summarize, it's like weight loss, weakness, cramps, increased thirst, increased urination, increased hunger,
Okay.
and frequent urinary infections, and visual symptoms like blurring of vision and all
Okay, these are the symptoms.
of
Early,
diabetes.
early symptoms.
These are not necessarily early symptoms. Early diabetes, they doesn't have any symptoms. That's
Okay.
the problem with diabetes. If the sugars are not persistently high, they are just like, say, if you 150 or 180, people need not have any symptoms. So that's why it doesn't cost much to test anyone. Nowadays, even the government vehicles which come to the village, they do free glucose testing. So
Yes.
everyone should get tested for diabetes after they cross 20 years at least. So no age is immune from diabetes. So the best thing to do is to get tested for diabetes.
Okay.